just thinking back 1 year ago where we were after COVID, and I think we were kind of in the middle of it. It was quite a difficult period. Let's say it was quite a dark period. We really didn't know which way we were going to go. We were expecting a lot more disease. We were expecting many deaths. Of course, a lot of that has happened, and especially in other countries in the world where the catastrophe has been big. So to one extent, we could say in Kenya, we have been spared the worst of COVID. But even at that time, we did our first study with KPMG because our members were asking what is going to happen next? What are we going to do? What are the things we need to be dealing with? And at the point, we did focus on people because we said, one, health is your first issue. We must remain healthy. And then start looking at operations. How are we going to keep our logistics moving and keep Kenya moving? And thankfully, we were able to do both during that period. So 1 year later, it's actually fascinating if you sit down and think about how many things have changed since. Treatments have definitely changed quite a bit, as well as the capacity for us to treat in terms of the health capacity that we've built up, the availability of PPEs and things like face masks and so on, people's understanding of the disease, PCR testing. And of course, you can't forget vaccines because those are supposed to be one of our tickets out of this situation. Last year, there was no sign of any vaccines at this stage, but now we have vaccines, several vaccines going around the world. And in fact, even in Kenya, we have people who are vaccinated, and we continue to grow that on the vaccine basis. Similarly, for our businesses have continued. Some struggled. I think some did have big challenges and have closed. But many of our businesses have survived and made it through the worst part of or at least the first part of that challenge. So it is an interesting time for all of us. But I think we decided together with KPMG, like we did last year, how do we assess ourselves? How do we look at where we've come from, what we've been able to do, and hopefully where we'll be going forward. And generally, we could say last year, maybe the issue was survival. How are we going to make it through the first waves? Because those were the big issues then. Would we still have raw materials? Would we still have markets to sell in? And that kind of thing. Now we've resolved that. It seems we've worked out how we can work through these challenges. We know how to work even through our travel restrictions, our lockdowns, and so on. But of course, that has not come without cost or challenge, but we have learned how to do that. So we are now in a phase of resilience. And I call it resilience because it is definite and probably agreed that the pandemic is not over yet. We have some ways to go. If you've been following even the global press, even countries that seem to have suppressed it this week are going back into lockdown. Places like Australia, which had largely suppressed this and gone back to full sports and opening and so on. We have countries like Israel, where vaccination is huge, but they are still getting new waves and having to take certain measures. When we look at ourselves, we've started vaccinations, but we are way behind what our challenge, our requirement to get to some level of herd immunity is. So we also have some way to go before we get through this situation. And as some of the medics were telling us, we are expecting some waves within the next couple of weeks as the disease continues. So we do still have to think about what are we doing in this situation. Now, last year, we came up with some proposals which we gave to government, and we are glad that we did get some of the asks that we got, things like the reduction of taxes. We had a reduction of corporate tax. We had VAT reducing, pay-as-you-earn reducing. Just some of the suggestions that we had put in there. Payment of pending bills and VAT refunds to keep liquidity going, and some focus on SMEs as well, which we got. Now, unfortunately, of course, some of those have been since reversed. So maybe there is something there, a continuing conversation about what are the needs that we're going to need going forward as well. Because this, like I said again,